Hello and welcome to NCTV episode 39, which is about osteoporosis and what you can do to build bone strength and prevent bone loss in later life. Osteoporosis is often referred to as the silent disease because there is very often little sign of it existing. So firstly, what is osteoporosis? Well, put simply, it is a condition that speeds up the loss of bone strength. Despite popular belief, it's not confined to elderly, frail ladies or postmenopausal women either. People of any age, particularly if your mobility is restricted, can suffer from it. Some other causes can include poor nutrition, eating disorders, overtraining in a particular sport, or chronic steroid use. Whilst it's common in women, note that men can suffer from osteoporosis too, with the ratio being approximately 1 in 3 women and 1 in 12 men, resulting in over 3 million people who currently have it in the UK. The reason women are at greater risk is because following the menopause, they lose the protective benefits that come from the hormone estrogen. Estrogen is responsible for facilitating the uptake and retention of calcium in bone, hence the accelerated decline in bone mass following the menopause. In older people, one of the main associated dangers of osteoporosis is suffering a hip fracture, which has an estimated mortality or death rate of 10% within the first month and 21% within the first year. Another common occurrence with osteoporosis is damage to your spine due to crumbling vertebrae, which can result in chronic pain and impact on your abdominal organs and lung capacity. Many don't regain full mobility or even independence following these, so knowing how to build bone strength and prevent fractures is of great importance. The good news is that there are treatments available to reduce the amount of bone loss resulting from both age and osteoporosis. The very best thing you can do is to achieve peak bone mass when you're young through good nutrition and an active lifestyle. However, for those of you who are over 40, the aim is to maximise bone strength and prevent bone loss through regular weight-bearing activities. The ironic thing is that the thought of participating in exercise or sport may be frightening because you may worry about suffering a bone fracture with impact, loading or falling. But the research has proven the benefits of exercise, if done correctly and safely, far outweigh the risks of osteoporosis. Here are 12 risk factors for getting osteoporosis. 1. Early menopause. 2. Hysterectomy. 3. A family history of osteoporosis. 4. If you're underweight. 5. Have an eating disorder like anorexia or bulimia. 6. Have amenorrhea, meaning that your periods have stopped or are irregular for 6 months to a year prior to the age of menopause. 7. If you have taken or are taking chronic steroid medication. 8. If you're a smoker. 9. Have an alcohol intake of more than 4 units per day. 10. If you lack calcium and or vitamin D, maybe through poor diet or minimal exposure to sunlight. 11. If you're not very mobile and confined to a wheelchair or chair or bed. And 12. Have an underlying medical condition such as hyperthyroidism or diseases like celiac, Cushing's, Crohn's, as well as diseases to the liver, kidney, rheumatoid arthritis and type 1 diabetes. Ideally, if you have a number of these risk factors, you should go for screening for osteoporosis every 2 years before you sustain a fracture. In terms of treatment for osteoporosis, the focus should be on managing the risk factors that can be addressed, like making lifestyle changes and participating in fall prevention classes. Excuse the lists, but some of these treatments, 9 in fact, could be in the form of weight-bearing exercises, calcium and vitamin D supplements, prescription medications, improving your BMI through healthy meal plans, getting outside in the sunlight when we get it, receiving treatment for underlying eating disorders, reducing alcohol consumption, changing or reducing chronic steroid medication, and finally, number 9, helping to prevent falls by removing hazards, having your vision checked, or being careful after taking medication that makes you feel dizzy or drowsy. So that just about sums up everything osteoporosis in a nutshell. Hope you found it useful, and I'll see you again soon for some more bite-sized bits to help your health flourish. Bye-bye for now.